Hey everyone, today I'll be talking to you guys about cardiac conduction and gap junction physiology. So, cardiac conduction, this is the conduction of electrical impulses and the pathways where electrical impulses travel through the heart to allow for the contraction of cardiac muscles. And cardiac conduction occurs in the sinoatrial node, in the SA node, and it travels all the way down to the atrioventricular node, which is the AV node. So from there, it will travel down to the bundles of His, and then down and spreading out in between the branches, left and right branches, and then ultimately to the bottom of the heart, which is the Purkinje fibers. Now, these electrical conduction and conduction pathways allow for the contraction of cardiac muscles, which basically allows the heart to pump and to bring blood to and from the body, around the body. Now, these electrical signals that regulate the heartbeat are caused within the gap junction, or the electrical signals are produced in between the gap junctions in an extracellular space, which is called the perinexus. And the electrical signals jump between and across the gap junctions, and this allows for electrical information to travel through the heart and the cardiac muscles. And this coordination and the timing of the electrical impulses that travel through the gap junction allow for a constant rhythm of heartbeat, and it allows for the heart to pump at a constant rate. Now, a common disease that occurs regularly due to the miscommunication or the abnormality of the electrical signals passing through the gap junction is atrial fibrillation, which is basically the abnormal pattern of the electrical signals passing through the gap junction and the perinexus does not collapse, which basically means that the electrical signals will not be able to make the jump between the gap junction because the space is still too big. So this would ultimately cause the upper chambers of the heart, which are known as the atria, to not beat and not contract to its fullest extent, which will basically cause the atria to quiver, and it will reduce the blood flow throughout into the ventricles, and then ultimately reduce blood flow to the rest of the heart. Now, this quivering could also cause coagulation in the atria, which basically means the blood clots at the valves that lead to the entry to the ventricles, and this would also reduce the blood flow into the ventricles and reduce the blood flow to the rest of the heart. And you can see in here where in the upper waves there are a lot of sporadic and very short bumps, and this basically shows the quivering of the atria, and this shows that the atria is not fully contracting when you look at the ECG waves. And in this diagram here, it also shows the irregularity and the small bumps in between to show the atrial fibrillation and the atria quivering and not coming to a full contraction and having distinct waves after the QRS complex. And in order to treat atrial fibrillation, recent studies have suggested to close the perinexus, which is the extracellular space, which basically allows the cells to be together, which allows for the impulses to travel through the gap junction more effectively and at a more stable rate, and this will ultimately reduce atrial fibrillation. And slowing the heart rate and maintaining the rhythm will also correct the heartbeat and will correct the contractility of the atria. And the use of anticoagulants, which will thin the blood, which are medicines that thin the blood, will reduce and prevent and cure coagulation and would be able to maintain a steady blood flow. And other factors that also allow for the curing or prevention would also be maintaining a healthy diet and maintaining a balanced exercise plan. Thank you.